Hey friends, happy Saturday. I'm popping back on here to chat with you guys more about operating room nursing and what the heck does an OR nurse actually do. So let's talk about it. There are two main roles of an OR nurse. You have the scrub nurse and the circulating nurse. However, I do want to point out that not all hospitals and facilities will teach their nurses how to scrub, because there are also surgical techs who can perform the same job. So if you are looking to learn how to scrub into a surgery, it is important that you ask the hospital or the facility if that is something that they will teach you how to do. So the hospital that I did my training at did teach the nurses how to scrub, because not all nurses know how to scrub. So what a scrub nurse will actually do is they will set up the whole sterile field, the whole back table. The back table is what we call the sterile field, where all the instruments are on. We set up all of the sterile instruments, all the trays, all the supplies. We have everything laid out, ready to go for the surgery. And then once the surgery starts, we are that person that is handing the scalpel, handing all of the instruments. The job of a surgical tech or a scrub nurse is very important, because if shit hits the fan, you need to be able to know what you're doing, because you are that surgeon's right-hand man. You have to anticipate what they're going to need, and it's really important too that you know all the instruments and you know the surgery and what that surgeon is going to need. So like I said, you can anticipate the next steps, and that's what makes a good scrub nurse or a good surgical tech. Now, the other role of the nurse in the OR is called a circulating nurse, and the circulating nurse is the eyes and the ears, the whole facilitator of the OR. Their main responsibility and main goal is patient safety and keeping that patient safe and being that patient's advocate, because obviously that patient is asleep and they cannot speak up for themselves, and that is our job. But a little bit more of what we do: so we will go to pre-op, make sure that the patient has everything that they need to perform the surgery. The consents are all proper, they look correct, they're signed. We go over the patient's history with them. We will also help the surgical tech or the scrub nurse to set up the whole sterile field. We will open lots of trays, or just one tray depending on the surgery. All of the supplies that they need, we will open it sterilely to the sterile table. We will assist in positioning the patient however the patient needs to be positioned for surgery. If it's a spine surgery, they might need to be laying on their stomach or their back, or frog leg, lithotomy, like all different types of positions that someone could be in for surgery. We also assist with the anesthesiologist in intubating the patient and going off to sleep. We will administer any medications to the sterile field that they might need, mostly local anesthetic or antibiotic type of medications. It is also the circulating nurse's job to do all of the documentation, which is very important in an OR setting. I feel like one of the biggest places that patients sue is in surgery or because of surgery, and a lot of the times they will rely on the nurse's documentation to go back and see what happened during the surgery. We perform counts with the scrub nurse or the surgical tech, where we count all of the instruments or the sponges, the blades, all of the materials that could potentially get lost inside of a patient. We are counting them and we are documenting it. We will also go and retrieve any instruments or sterile supplies that they might need during the surgery if they don't already have it on the sterile field. Let's just say they hit a blood vessel and they get into a lot of bleeding and they need a bunch of more materials. It is our job to go get it in a timely manner and make sure that they have it on their sterile field for the surgery. Being an OR nurse really is so fun and fascinating. I am always learning new things. There are so many different types of surgeries that you can specialize in, or you don't have to specialize. You can go into cardiovascular surgery and specialize in that. You can specialize in transplants, or you can do a little mix of everything, or you can work in a outpatient surgery center that just does orthopedics or plastics, or very niche type of area. So many different things you can do in surgery, and that's one reason I really like it. I'm always learning new things, and I also love that it is a team environment. There are multiple people in one room for one patient, and if we can all work together well like adults, then things run really smooth and it can be super fun. So let me know what questions you have, and we will chat it up in the comments, and let me know what kind of video you want to see next. Okay, bye guys.